The increasing burden of disease, both communicable and non-communicable, has led to a lot of research on better methods of prevention. This has led to the discovery of the importance of preventing the occurrences of diseases even before you're born. With this, it is safe to say that your health status is actually determined before even you're conceived. So what are some of the strategies that we can use to prevent the occurrences and reduce the burden of diseases in our country? The first thing that we need to do is ensure that we protect and prioritize the health and nutrition status of women of reproductive age. This is important because the health and nutrition status of a woman before pregnancy has been associated with better pregnancy outcomes. The next thing that we need to do is encourage women to ensure that they take care of themselves while pregnant. They reduce intake of toxins like cigarettes, alcohol, drugs, and exposure to toxicity. It is very important because it has been shown to help in improving the outcomes of the baby, reducing neurological disorders that can be due to injury from toxins. It is also very necessary to ensure that our women are well supplemented and their nutrition status optimized at all levels of pregnancy to ensure that the baby gets the best while they are in the womb. The next thing that we are being encouraged to do is encourage vaginal delivery. Why am I talking about this? Because there is data supporting the importance of the microbiome, that is basically the gut bacteria, in disease prevention and health outcomes. In the last trimester of a woman's pregnancy, the bacterial composition actually changes from the woman to actually favor the DNA and the genes of the baby she's carrying. As the baby comes out of the birth canal, that is basically the vagina, they get the necessary exposure to the bacteria. This is very important in protecting your child's future health because microbiome again has been shown to have very protective aspect in mental disorders, cancers, in diabetes, cardiovascular diseases. Of course, if it's an emergency, by all means, C-section was discovered to ensure that you, the mom, and the baby come out okay. So do not hesitate. The next thing that we are being told to encourage is actually exclusive breastfeeding. If you don't want your boobs to sag, because most women will tell you, Mumina, me, I don't want my boobs to sag, or my husband will leave you. If he's to leave you, will still leave you even if you with your boobs still at parks. If you're not in a position to stay with your baby full time, you can always express to ensure that you promote lactation. If your supply is inadequate, work with a dietitian. Let them help you in ensuring that you have adequate supply of milk. Another thing, the breast milk has the polysaccharides, oligosaccharide, that is very important in feeding those bacteria that he or she has gotten from the mom's birth canal to encourage repopulation and getting the good numbers that we want. And then the next thing that we are going to encourage is adequate, timely, and appropriate weaning. The types of foods that you're going to introduce your baby to are also going to set them up for life. You see, we have inherited the bacteria from our moms through the birth canal, and then the breast milk, with the help of the polysaccharides, has been providing nourishment to our bacteria to ensure that they are growing. Now that when you introduce feeds, you're supposed to ensure that you're also introducing feeds that are going to trigger activity and ensure that you continue the repopulation of this gut microbiota. It is very important to ensure that our babies maintain good digestion system, to ensure that our babies maintain good metabolism system, and to ensure that our babies maintain the best health possible. One of the things that you need to be very cautious about when you're introducing feeds to your baby is sugar, because it is going to repopulate even the bad bacteria, and when they outweigh the good numbers, that becomes a problem. You have babies getting issues with frequent infection, frequent diarrhea, small flus here and there. They cannot leave your baby alone because you are overfeeding them unnecessary things like sugar, processed and refined foods. Feed your baby the healthy options. When your baby is feeding, give them variety of foods. In Kenya, we pride ourselves with variety. Do not give your baby one particular type of food every single day. They'll get bored. You will deactivate their microbiome, and then you will kill them because they are not working. They become irrelevant, and then the diversity in their stomach goes down, and this is the same thing that is going to happen when disease comes in, because they will not be in a position to counter effect or counter attack for these microorganisms that are coming in, because maybe you have killed the gut bacteria that was supposed to help them fight such small infection. Of course, there are things that you cannot actually control, like maybe injuries during birth that may predispose your baby to other conditions, or maybe genetic disorders and such. But again, there are studies that have shown that timely and appropriate nutrition and health care before during and after childbirth are really good in ensuring that we prevent the occurrences of the genetic complications. So it is important to ensure that you encourage feeds of variety of foods at all times, healthier options, well cooked meals, clean and safe, to ensure that our babies, again, we promote and encourage their defense systems to be the best that they can be. Another thing, encourage play. Instead of feeding the baby with the unnecessary dopamines from too much screens, let them go outside, play in the sun, play in the mud. They'll be okay. Nothing will happen to your baby when they are playing. In fact, you'll be doing them a favor and actually promoting them when they come of age, to prevent the occurrences of these non-communicable diseases, because nowadays it's a common thing to get someone who has been living healthy, who has been not smoking, who has not been drinking, develop cancers or any other chronic disorders that you have no genesis of where they come from. There's the aspect of bias and such, but there's a lot of retrospective studies that actually trace back the occurrences of these non-communicable diseases to childbirth, to weaning, to breastfeeding habits, to even nutrition and health status during their first 5 years of life. So prevention starts now, not when it happens. Of course, it's always cheaper to prevent than to treat. It's less hectic and it's less draining. So let's do the best that we can with our kids. Let's do the best that we can with our society. Spread the word, spread the gospel. Let it be known that some conditions can be prevented with the very things that we think are just normal, minor and such. They're very important in ensuring that you have the best health outcomes. So give this video a like and consider subscribing. You join the family and we continue learning. So make sure that you watch this video on how to eat healthy without restrictions, without the unnecessary conditions that people have actually associated with healthy eating, and let's meet there.